So the first thing that we're going to do is a little bit of myofascial stretching, and the whole principle behind the myofascial stretching would be to complete a stretch and then to hold it for at least that 90 to 120 seconds. It's always best to have your client do one repetition for a longer period of time than it is for them to do multiple repetitions if you're wanting to get to the myofascial level. So I also always like to have my clients, sitting on a therapy ball, because it helps to assist and support them, and it makes it easier for them to have minor little shifts in their weight to provide them with comfort, especially if they're having pain. So we're going to begin by I'll demonstrate a few different methods of stretching or a few different techniques and apply the myofascial principles to them. So we're just going to start with the neck. And you're going to have the person kind of, move the ball so that they can get their pelvis underneath them and to feel nice and steady. If they have a wide base of support here, then they won't feel insecure about falling off of the ball. And if they do feel insecure on the ball, you can actually have the ball right up against the wall so that helps to provide some stability. If they still need additional stability, you can actually put little towel rolls underneath the sides and even the front of the ball, and then have the back of it against the wall, and that can provide additional stability. So we're going to start just with some neck stretching, and you're going to have them first tuck their chin and then bring their ear to their shoulder. The key here is to not let the shoulder come up to the ear. So what I'd like to have them do is to actually put their hands along the side of the ball and then kind of wiggle their fingers down. And that really helps to set their shoulders and kind of remind them to keep their shoulders down. And then with their chin tucked a little bit, you're going to have them bring their ear to their shoulder. And you're going to have them do this to each side. And again, the idea is to have one repetition for a longer period of time. If they're at a point where they can accept overpressure for that, then that's even better. So they're kind of wiggling their fingers down on one side, and then you take this other arm and just kind of rest your hand on the head so that they're not yanking their head, but they're just kind of resting their hand on their head for a little bit of overpressure. And then the goal would be to hold this at some point up to 90 to 120 seconds. They probably won't be able to do that at first. So just, even if it's 20 or 30 seconds, and as the tissue begins to relax, they can stretch further into that. So you're going to be able to have them do that in both directions. Again, you're going to wiggle the fingers down, have them bring their head to the side, and then just apply gentle overpressure like this. Now, if they want to give even a greater stretch to the trapezius muscles, then what you can do is use a theracane and have them actually anchor, and this is where it becomes more like a cross-hand release. You can actually have them anchor the one side into the trap with the theracane, just have them kind of, rest their arm here, and then bring their head to the side and apply some gentle overpressure. That gives a deeper stretch, and it also begins to release the trapezius muscle as well. For forward flexion, you're going to ask that they first tuck their chin and then bring their head forward. If they don't do that, they're going to get a lot of chin jutting and not as much good neck flexion and a good stretch of the suboccipital muscles. So again, you have to tuck your chin first and then roll your head forward. To accentuate that stretch, you would have them actually take their hands and walk them down to the ball, and then tuck your chin and forward. And you could also apply overpressure there if that's warranted. You can do the same thing for stretching the neck side to side. Again, bringing your fingers down the ball and turning. And they can again apply gentle overpressure if that feels good to them. Do that in both directions as well. And the other thing that you can really encourage them to do is to modify it to really provide their greatest stretch. So rather than it being really specific to, what you want to be specific is actually the chin tuck and the direction. But if they want to use the Theracane to really provide even more stretch, that's where they have a little bit of flexibility, and ask them to find what feels comfortable and where they get their greatest stretch to really make it unique to them. For the shoulder exercises, you're going to, the way you can use the ball in order to really facilitate a greater stretch is, when they bring their arms forward into some protraction, they can kind of push back on the ball. That allows a nice stretch all the way through their shoulder as well as into their low back. So it gives it a little bit more of a total body stretch. And then if they just want to even rock the ball slightly side to side, they can see where their greatest tension is and where the best place to stretch would be for them. So it becomes not just a shoulder protraction, but it also gets into some trunk rotation, side bending, and some lower back stretching. And they bring their elbows back, and same thing here, that if you want to bring into some gentle back extension, you can have them roll the ball backwards. That allows for not only retraction of the scapula, but also a nice stretch in their trunk without a lot of pressure on their trunk. In order to stretch the lateral aspect of the shoulder, have them bring their arm right across their chest, and then really use their hand to assist the process and to maintain the stretch for longer periods of time. Whenever they do this stretch, again, you're probably not going to be able to do it for that long of a period of time. Your goal in the end is to get to that 90 to 120 seconds of stretch in order to engage the fascial barriers. But what they can do is, as their tissue begins to elongate, have them continue to follow that tissue into a new end range and then hold it there. For every stretch that we do, we're going to do it, you're going to ask them to do it bilaterally on both sides, just so that they have the maximum symmetry and balance. Even though one side may be tighter than the other, it's still important to do both sides. All of the stretches that are listed in the packet can be done on the therapy ball, and to secure the therapy ball, as I had indicated before. The next grouping of exercises we're actually going to do over the ball. I like using the therapy ball because it provides a good amount of support, and it allows them some freedom of movement. And when people are in pain, they're really afraid to move. And by giving them that support and allowing them to do just little tiny minute movements, it gives them the freedom to move, but to also feel supported. In order to allow a more whole body stretch, we're going to use the therapy ball to support the entire trunk while we do some stretching. You're going to have the person begin in sitting, and then if they walk their feet and kind of slowly lay down on the ball, then that will provide a nice support here. And then depending on how much flexibility they have and what their comfort level is, they can start with just even a stretch like this. To advance that, they can just put their hands behind their head. If this is too much, they can bring their elbows forward. And then to provide an even greater overall trunk stretch, then they can actually walk their legs out, and to extend it even further, bring their arms out. Once in this position, you can kind of do a little bit of stretching, see what feels the most comfortable and where they feel like they need to be stretched, and then hold that position. And to make it even more engaged, you can have them put like a 1 pound weight in their hand, and that will also give them the ability to stretch and maintain a sustained stretch against a barrier. To come back up, just have them walk their feet until they get to the ground. Now for a lateral stretch, you're going to have them start in a kneeling position, kind of come up to a half kneeling position, and then kind of wrap their hand around the ball, and then push with their legs out. Now if they've got a wide base of support with one leg in front and one leg behind, that really creates some stability in the ball. And then they can just kind of rest their head and reach with their arm. You're going to get a different stretch depending on where you are as far as your reach. So if in this position, you're really going to get a stretch through here. But I could roll the ball back just a little bit, and that becomes more of a diagonal stretch in one place. And if I reach backwards, it will give me a diagonal stretch more through the anterior chest. There is also a difference depending on which leg is forward. So if you want a slightly different stretch, you could actually switch the legs, and that provides you with more of like an ITB stretch. And again, you would do that to both sides. When someone is having a lot of compression, discomfort right in their lumbosacral area, what you can have them do is lay forward over the ball and then just bring their knees slightly off of the ground, and that really provides some nice traction at the lumbosacral joint, and that can create a great deal of relief. We had done the global trunk stretches on the therapy ball, and the other thing that we could do is some cervical stretches using the ball to facilitate a passive range of motion. And what you want to, this is really kind of a more advanced technique, so you have to be careful when you instruct this that you teach the person to only go to the level that feels comfortable to them. For neck flexion, what you can do is have the person sitting with the ball against the wall and then slowly kind of slide themselves down to a range of motion that is comfortable for them. And then you're really going to try to encourage them to relax, allow their shoulders to come down, and really stretch the posterior aspect of their neck. And again, they're going to hold, the idea would be for them to hold it there for one repetition, maybe starting at around 10 seconds, but gradually increasing their time they're spending there and gradually increasing the range of motion as their tissue releases. To allow neck side bending and rotation, you're going to approach the ball, from the side and put the ball against the wall. And then basically what I'm going to do is put my head against the ball and try to pull my shoulder down, so I'm getting some nice stretch. The more I pull my shoulder down and my arm underneath me, the greater the stretch in the trapezius muscle and the shoulder area. And then what you're really going to want to encourage them to do is just go to the level that feels comfortable for them without overstretching, and then really try to relax into it and hold for a greater and greater length of time, trying to get the muscle to relax and to increase the stretch as the muscle does relax. Could do that for side bending, and then for rotation, if they just leave their head and rotate their body until they find the part in the rotation where they are the most tense and need the most stretch, then they can just roll their body and their head until they achieve that amount of rotation, at which time they would hold, wait for a release to take place, and then glide into a further stretch as that occurs.